one in these homes, and it's very difficult. I recognize that the system is broken, and we're going to fix the system, but in the meantime, the number one crisis is making sure that we take care of these most vulnerable people in these homes, and we're going to do it. I'm pushing the system constantly on all fronts, and we said we'd do more testing. We're doing more testing. We ramped up to over 8,000, close to 10,000 every day. We're going to ramp up to 14,000. We're going to continue all hands on deck, and we're going to fix this system.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Good afternoon, Premier Ford.
Hi, John.
Question for you specifically about the use of the Canadian Forces members who are going to be coming into these homes. The Registered Nurses Association of Ontario has said that they're puzzled by this move. They think that there are additional healthcare workers out there who could step in and would be better suited to help perhaps than the Canadian Forces members in these situations. I'm wondering if you can address that concern, and what are these Canadian Forces members going to specifically be doing in the homes?
Well, I'll pass this over to the Minister of Long-Term Care, but they're going to be there to support the frontline healthcare workers in any capacity that they can. We need people, and if we need more nurses. If the nurses, by all means, they contact us, they'll be in a home immediately. We need all hands on deck right now. It's a critical time, a critical situation that we're facing, not just here around the country and around the world. But I'll pass this over to Minister of Long-Term Care.
So I am very, very grateful to the Canadian Armed Forces, to our military, who will be coming to support our most affected long-term care homes, to help our staff in their fight against COVID-19, give them the support that they need to care for our residents. Very vulnerable people need the support of our long-term care home staff, and struggling for a number of weeks now, some homes in dire need of staff. Despite our best efforts, allowing the acute care sector with hospital staff to come in, along with home care staff, along with the portals that we had created, along with the federal portals and the nursing volunteers, it still was not enough. And there was too much risk that our loved ones would not get the support they needed. So that's why we reached out to the Canadian Armed Forces, and they've heeded the call, and we are very grateful.
Follow-up?
Minister, also the province has extended a number of emergency orders today, including the order that restricts workers to one home. I'm wondering, and please correct me if I'm wrong about this, but it does not appear that the government has included temp agency workers in that again, that they are still exempt from that order. I'm wondering why that is. Does that not defeat the purpose of that entire order at all?
The agencies have been an important source of staffing. We were coming into this pandemic with shortages in our long-term care homes of staff, and that's why we had a study and expert panel put together to address what more we could do to improve the staffing in our long-term care homes, and that was an ongoing effort. So the staffing shortages preceded this. The agencies that provided staff were an important measure to make sure that our homes did not go without staff to support our long-term care residents. It's a balance of risks, but it was something that we had to take seriously, given what we've seen in other countries.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Good afternoon, Premier.
Hi, Robert.
This morning you extended the emergency orders, as Sean was just mentioning, to May 6th, basically ensuring that all non-essential workplaces will remain shut. We're hearing from a lot of industries like garden centers and Canadian Tire stores, things like that. They're wondering why they can't be open. Is it possible that those kinds of things will be open before May 6th, or are those going to stay closed for at least another 2 weeks as part of the pandemic closures?
Well, Robert, you'll be hearing about that over the next day or two. We'll be rolling that out.
Follow up?
So that's a really short answer, Premier.
No.
So maybe I can get a third question then. Does that mean that we'll be seeing, just giving some hope to those industries? Because, for example, the garden centers, they are an agriculture industry, and they grow their things on farms in Niagara and other parts of the province. They're wondering about what's going to happen to all their products, their plants, and they're not food per se, but they are farmed goods. So you'll have some positive news for them in the next day or so, you say?
Yes, we will, definitely, and I understand the situation they're in, and our government's going to act on that.
Next question.
Next question comes from Randy Rath from CHCO-TV. Please go ahead.
Hi, Premier.
Hi, Randy.
I'm wondering, given the horrifying numbers of deaths that have taken place in long-term care facilities, and the inherent lack of transparency in those facilities, given that families can no longer go in and visit their family members, should you be sending teams from the local health units in to inspect every single long-term care facility in this province to make sure that they are operating up to standards?
Well, I'll pass this over to the Minister of Long-Term Care. I know we've done a tremendous amount of inspections last year, but I'll let her speak on that. Thank you.
So on top of the regular inspections, annual inspections, there were over 2,800 inspections in our long-term care homes last year. But above and beyond that, the public health units are actually and have been going in to our long-term care homes to assess the situation and evaluate it on a risk basis.
Okay, and I'd like to return to Anson Place, if I may. They claim that they have reached out to all of their partners recently asking for help in running their long-term care facility. Do either of the ministers there, the Minister of Long-Term Care or the Minister of Health, are you aware of them reaching out to your ministry to ask for help?
I believe that we have been tracking them as a concern, and they are one of our priority homes.
Next question.
Next question comes from Travis Damrash of Global News. Please go ahead.
Hi there, Premier. Considering there are over 500 seniors dead and you've had to call in the military, why does the government seem unwilling to say, yes, there may have been missteps early on in our response, highlight what went wrong, and take responsibility by saying how you're going to fix some of these failures moving forward?
Well, I can tell you the system, a lot of systems are broken down here, and I've mentioned it before. We're down here fixing the systems, and this is pretty clear. We can do better, and our number one priority is to make sure we put the resources that are needed in these long-term care homes. Make no mistake about it, Travis. The system we're gonna fix many systems down here, no matter if it's long-term care or just the way the government runs. If it was, just Ontario, that this virus is terrible. It attacks the most vulnerable, and it doesn't stay within the borders of Ontario. You just have to look across the country and look across North America and the world. It's a terrible virus. We have to do a better job, and at the end of the day, the buck stops with me, and we'll make sure we get it fixed. But my number one priority is to make sure that we get the people the help that they need right now, and that's what we're doing.
And my second question is on a different topic. Considering the financial toll this crisis has taken and will continue to have on municipalities, will you amend the Municipal Act to allow them to run operating deficits, or are you prepared to bail out cities like Toronto so they won't have to hike taxes?
Well, Minister Clark is working on that right now. He's in touch with the 444 municipalities, small, medium, and large, and we'll be sitting down with all of them. Again, we're going to ask the federal government for the support. We have a certain capacity within any province, not just our province. And as my finance minister always says, and I've said it before, the federal government has a printing machine, and we don't have that printing machine. And I just want to thank the federal government. They've stepped up huge for everyone across this country. They've always been there. We put a request in, they step up. So we'll be working with the federal government along with the municipalities and the province. And I think between the three of us, we can come up with a solution that works out well for everyone.
Last question.
Last question comes from Sabrina Nanji from Queen's Park Today. Please go ahead.
Oh, hi, Premier. Thank you for taking my question. I'm wondering if you can give us a sense of where you'd like to be in terms of testing and contact tracing before we start to open up parts of the economy again.
Well, our next tier is 14,000 tests a day. And we want to continue on with the 14,000 tests a day and contact tracing equal to that. We have to make sure we pick up the contact tracing alongside with the testing. But I'm really proud of our health table and Dr. Williams and everyone around that table. I was a little frustrated a few weeks ago, and you know, they did a great job. And they picked it right up to 10,000 a day and 14,000 by the end of the month. So I want to thank them for doing a great job. And we're going to continue. We aren't going to stop. We're going to continue working day in, day out, around the clock, literally around the clock, to make sure that we test as many people as possible, especially in the high priority areas.
Thank you. And if I can follow up on a slightly different subject, officials said this week that they were turning an eye to bringing back some of the postponed surgeries because hospitals haven't really been crushed with this wave that had been expected. Can you tell us the timeline for re-ramping up these surgeries and what that could look like? Will some surgeries take precedence, for example?
I'll pass this over to the Minister of Health.
That is something that we are considering right now at such time that we are able to start loosening some of the restrictions. I know that many people have been waiting for surgeries, particularly cancer surgery, that we want to be able to start those as soon as we're able. But as we know, there are certain things that have to happen before we can do that. One is to get the testing up to the levels that we need, the contact tracing, the surveillance in the community in terms of testing asymptomatic people, but especially getting the numbers of cases down. We actually are continuing to see cases well over 500 on a daily basis. We need to see that number go down, because we are at the peak, meaning that we have hit the maximum numbers of cases we expect here in the province, but we need to see those numbers go down before we can start getting into things like surgeries that have been postponed, opening up parts of the economy and opening up parts of society. So we still have some work to do, but it is something that we are planning for already.
Thank you.
Thank you, everyone.
And you are listening to Ontario Ministers, as well as Premier Doug Ford, giving us the daily update on the COVID-19 situation in the province. 634 new cases. That's the largest single day cases in the country's biggest province, with 54 deaths. We also heard more about the Canadian Forces military help that is going to go into some of the most affected long-term care facilities to help out there, just as they have in Quebec. And the Premier saying the system is broken when it comes to long-term care, echoing what the Prime Minister said earlier when he used the word failure, that we are failing some of the most elderly and vulnerable people in this country. You're watching CBC News Network. We're back in a moment.
Good evening. evening. I'm Andrew Chang.
And I'm Adrienne Arsenault. Things are changing, and they're changing fast. The way we live, the way we work, our sense of safety.
But one thing that won't change, our commitment to you.
The program may look a little different over the coming days and weeks as we adapt to this new reality.
But we will still be here with the facts, the advice from experts to sort through it all with you, because this is The National.
From the world's #1 selling pain reliever, new Advil Mini Gels. Mini. Easy to swallow. Fast and effective pain relief. New Advil Mini Gels. Advil and go.
10 reasons to smile, 10 reasons to take a break. Spend $10 at Tim's, and you'll get 10 Timbits free.
Sure Health from Green Shield Canada. How do you protect yourself and your family from healthcare costs not covered by your government health insurance? Like prescription drugs, dental and vision care, physiotherapists, chiropractors, emergency medical travel expenses, and more? Expenses that could cost you thousands of dollars a year? The answer is Sure Health from GSC. Sure Health plans protect you from healthcare costs not covered by your government health insurance, including prescription drugs, dental care, vision care, physiotherapists, chiropractors, online mental health therapy, travel, and more. And if someone in your family has a serious accident or illness, even while traveling, Sure Health covers those expenses too. For most Sure Health plans, your acceptance is guaranteed, with no health exam and no medical questions when you apply. And it's affordable. Protect your health and your finances. Call 1-844-599-7873 or go to surehealth.ca now for your free, no-obligation Sure Health brochure.
Across Canada, our homes are more important to us than ever. At Leon's, it's our commitment to Canadians to make sure you have access to appliances you can rely on, mattresses you can rest on, and everything else you need for your home. Leon's.
The Waterpik Water Flosser removes plaque from treated areas and is more effective than string flossing. Brushing only gets the surface, but the Waterpik Water Flosser cleans the areas brushing may miss. The Waterpik Water Flosser.
The Premier of Saskatchewan has announced a 5-stage reopening of the province's economy.
En COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur la COVID-19 au Nouveau-Brunswick. Speaking on behalf of the province today are the province's Medical Chief Officer of Health, Dr. Jennifer Russell, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Bon après-midi. Good afternoon. Just before I begin my formal remarks, I just wanted to take a moment to express my sincere thanks to the entire GNB team. So everybody who works in government of New Brunswick, obviously we wouldn't really be here today if it weren't for the amazing support and hard work of every provincial department, every provincial employee and agency, as well as the federal government and the many partners outside of government. So, and I'd also like to acknowledge the level of leadership and the civil servants, that of Premier Higgs and the cabinet, the COVID-19 all-party cabinet. We've had a lot of successful conversations and we've had a lot of exceptional work that has been done in the last couple of months. I'd also like to thank the entire Executive Department of Health and the team at the Provincial Emergency Operations Centre for all of their work, and all the men and women that are working on our borders. So the list goes on and on. I can't name each and every one of you, but I just wanted to say thank you for all of your hard work. Alors, je voulais juste remercier beaucoup de monde avant que je commence mes notes formelles. Et je voulais dire qu'aujourd'hui, c'est vraiment gratuit à le beau travail de tout le monde au gouvernement de Nouveau-Brunswick. Et grâce à ce travail qu'on est rendu où ce qu'on est maintenant, au niveau du gouvernement provincial, le niveau du gouvernement fédéral aussi. Et je voulais aussi remercier le leadership aussi, le Premier ministre Higgs et aussi le cabinet COVID-19 et aussi tous les exécutifs du département de santé et aussi tous les gens qui travaillent pour les opérations d'urgence provinciales et aussi tous les gens qui travaillent à nos frontières. Il y a une liste très longue et je ne peux pas remercier tout le monde, mais je voulais vraiment dire aujourd'hui un gros merci pour tout le beau travail que vous faites pour nous arriver ici avec le succès et de travail exemplaire qu'on a réussi dans cette province à date. So, good afternoon, everyone. For the 5th consecutive day, there are no new cases of COVID-19 to report in New Brunswick. We have had 118 cases to date, of which 14 remain active. There are 5 New Brunswickers with COVID-19 who are in the hospital, and I ask that you keep them in your thoughts. Our results have been heartening, and I continue to be encouraged by the progress we are making in slowing the spread of the COVID-19 virus in New Brunswick. I am grateful to all of you who have contributed to the success we have achieved to date, and that includes all New Brunswickers who have been doing their best to stay at home, wash their hands, wear masks when they go out, socially distance, always 6 feet apart from people. I really respect all that effort at this point in time, and that has contributed to our success and the many sacrifices that people have made. Pour la 5e journée de suite, il n'y a aucun nouveau cas de COVID-19 à signaler au Nouveau-Brunswick aujourd'hui. Il y a eu 118 cas confirmés dans la province jusqu'à présent et 14 d'entre eux demeurent actifs. À l'heure actuelle, 5 personnes du Nouveau-Brunswick sont hospitalisées après avoir contracté le COVID-19 et je vous demande de les garder dans vos pensées. Nos résultats sont réconfortants. Je continue à être encouragée par le progrès que nous réalisons en vue de freiner la propagation du virus responsable de la COVID-19 au Nouveau-Brunswick. Je suis également reconnaissante envers vous tous qui avez contribué au succès que nous connaissons jusqu'à présent. The next phase of the struggle to contain COVID-19 will soon begin, as it is in other jurisdictions. There will be a measured and methodical process to reopen our province, and we will step carefully as we go forward, and I urge you to do the same. My advice to New Brunswickers has been clear and consistent since the pandemic began, and it won't change in the weeks ahead. As the restrictions now in place are slowly loosened, I will continue to ask that you stay at home as much as possible, in your own home as much as you can. But also remembering that while you're doing this, to do all the healthy things that you can do at home, eat healthy, exercise if you can, get enough sleep, do things that are supportive in terms of helping you cope with however you need to do that. So I will continue to urge you to maintain at least 2 meters of physical distance between yourself and others. And while physical distancing is difficult, I'll ask you to wear a non-medical mask that covers your mouth and your nose to protect you from having secretions that can infect somebody else. And I will continue to ask that you wash your hands thoroughly and regularly and frequently clean doorknobs and countertops in your home. When I was younger, I used to take piano lessons, and my parents were relatively strict, and they were trying to motivate me, though, in a positive way. So they would put they had a sheet of paper, a chart on the fridge, and after my half-hour or hour of practicing every day, I'd have to put a star on the date in the calendar on that little box. And at the end of a month, I would get rewarded with a Star Wars figurine. So, you know what era that was in. But it was very motivating and rewarding, and obviously I learned to play the piano quite well because of that. So again, I think as we practice these things and we practice these measures and we get better at them, I want everybody to get their gold star in terms of, you know, doing all of these things regularly and comfortably, because that really is going to be part of our new normal moving forward. So these are all elements of our new normal, and je continuerai de vous demander avec insistance de vous maintenir à au moins 2 mètres de distance des autres. Je continuerai de vous suggérer de porter un masque non médical qui vous couvre le nez à la bouche lorsque il sera difficile de respecter les consignes de distanciation physique. Je continuerai de vous demander de bien vous laver les mains régulièrement et de nettoyer fréquemment les poignées de porte et les comptoirs dans votre maison. Ce sont tous des éléments clés de notre nouvelle normalité. Et comme je vous avais dit en anglais tout à l'heure, quand j'étais jeune puis je pratiquais le piano, mes parents me dirigeaient de faire sûr que je faisais le montant de pratique qu'il fallait chaque jour, et je recevais une petite étoile à la fin de chaque journée. Puis après un mois, j'avais reçu un petit cadeau. Alors moi, je veux que tout le monde soit vraiment, vraiment confortable avec le nouveau normal qui inclut laver les mains fréquemment, rester une distance de 2 mètres entre vous et les autres, sortir seulement pour les choses qui sont vraiment nécessaires, et aussi porter un masque pour prévenir que vous pouvez infecter d'autres avec vos sécrétions. Alors ça, c'est vraiment, vraiment important que nous sommes vraiment confortables et on pratique ces choses beaucoup, beaucoup, beaucoup. So the actions that you have taken to slow the pace of COVID-19 remain vital, and I will continue to urge that you follow this direction in your daily lives. We have thus far succeeded where so many other jurisdictions have faltered. So let's not lose that advantage that we have built over the last 6 weeks. And at every single stage, I have told New Brunswickers that what happens next is in your hands. And I'm proud of how we have all responded to that message, but we will have to maintain our guard. The COVID-19 virus can and will take advantage of any loophole we give it. We will move forward, but with appropriate caution, and we will not rush in blindly. And you can assist in this process by continuing to do what you are doing, but also remember to be supportive of others. Again, everybody is dealing with the stress of this differently, so it is really, really important that we support one another, and it is also important that if we can't do that support, provide that support, that we help people get in touch with resources that can. That is very, very important. And when you deny the virus the opportunity to spread through our province, you are saving lives. While our healthcare system continues to focus on the COVID-19 crisis, it is important that we also pay attention to other health issues. Our health system remains open and will be here for you when you need it. If you have an urgent health issue, you can go to a hospital emergency room. So please don't stay away if you're afraid. You need to get care. You have access to that care and you should get it. If you are feeling overly stressed and anxious, help is a mouse click or a phone call away. Take advantage of it. Asking for help is not a sign of weakness, it's a sign of strength. The impact of our actions on the health of society as a whole. The social determinants of health will be our guide as we move into the next phase of our struggle against COVID-19. And by that I mean all the aspects of a person's well-being are taken into account, and we do understand that the measures that have been in place have really put a strain on those other social determinants of health that are not just revolved around containing the virus. So all the other parts of society, the economy, safety and security, people's well-being, and other parts of normal society, those things have put a lot of strain and stress on people. So we will really be keeping that in mind as we move forward. Les répercussions des mesures que nous prenons sur la santé de la société dans son ensemble, soit les déterminants sociaux de la santé, nous serviront de guide dans la prochaine étape de notre combat contre la COVID-19. Thank you.
Good afternoon. Bonjour. For the 5th day in a row, I'm thrilled to hear Dr. Russell's announcement that we have no new cases of COVID-19 in New Brunswick. This is great news. This week, we have had only one new confirmed case. Le Nouveau-Brunswick est sur les bonnes voies pour lutter contre cette pandémie. Je sais que les gens se demandent à quoi va ressembler le processus de rétablissement. Ils se demandent quand nous allons pouvoir commencer à lever certaines restrictions imposées dans le cadre de l'état d'urgence. I expect to have more information about our initial recovery plan in the coming days. I look forward to sharing more details. I want to take a moment today to thank New Brunswick's pharmacists. During this time, this very difficult time, they have played an important role in our communities as essential frontline workers. They are doing an excellent job of making sure residents have the medications they need. I know many New Brunswickers have been required to pay multiple dispensing fees or co-pays due to a 30-day limit on prescription drugs. This was due to the concerns the College of Pharmacists had, which regulates prescription drugs. They had a concern that we could have shortages. As a result, people who would usually receive 60 or 90-day prescriptions have been receiving refills to last only 30 days, leading to more frequent fees than normal. Ces frais supplémentaires pour les médicaments ont un impact très important sur nos aînés et sur les personnes à faible revenu. Les personnes qui ont un revenu fixe se retrouvent dans une situation où ils doivent choisir entre payer leurs médicaments, leur épicerie ou leur loyer. In addition to costing more, the directives put in place by the college were causing more visits to pharmacies. That is why we made the decision to override the 30-day prescription drug limit effective tomorrow. People have been paying additional dispensing fees and copays will no longer need to, where a supply issue does not exist. I understand there are concerns about potential medical shortages, and that's why we're also establishing a New Brunswick working group. This group will keep a close eye on the province's drug supply and will identify any drug shortages. If there are shortages for certain drugs, a 30-day policy may be deemed necessary for those particular medications. In short, the supply will continue to be protected. As our province slowly moves into its initial recovery phase, I want to caution you that it will not be as easy as flipping a light switch. Nous devrons agir de manière stratégique et rouvrir les entreprises lentement à mesure que nous nous adaptons à notre nouvelle réalité. En tant que province, nous avons fait un bon travail pour aplanir la courbe jusqu'à maintenant. Mais la prochaine étape sera tout aussi importante. If we move too quickly, all of the efforts we have made over the last 6 weeks could be lost. I must remind all New Brunswickers that moving into recovery does not mean the threat of COVID-19 is gone. If we begin seeing a spike in cases, it will be necessary to put restrictions back in place. In fact, we should expect that even as restrictions are slowly lifted, some may need to be reinstated down the road. We can anticipate that we will continue like this for some time until an effective vaccine is widely available. With recovery comes risk, and we need to minimize those risks wherever possible. We will make strategic decisions about which sectors can open, and when, based on several factors. We will take into consideration the risk level of each sector and their ability to implement health and safety measures within the work sites. We will also take into account the impact of different sectors on our provincial economy. I am working closely with the All-Party Cabinet Committee on COVID-19 and with Cabinet to make these decisions. Si nous rouvrons trop rapidement, nous risquons d'avoir une deuxième vague de ce virus qui pourra avoir de graves répercussions. We've seen incredible resilience from New Brunswick businesses throughout this pandemic, and I know they will continue to adapt to this evolving situation. To reopen, businesses may have to reinvent the way they operate. This could include continuing to allow employees to work from home, if feasible. It may involve offering curbside pickup and delivery options to customers. Physical distancing and protective equipment will have to be factored into business operations going forward. Right now, New Brunswick is facing a unique opportunity. If we are agile and work together, we can come out of this situation even stronger than we were before. Nous devrons tout tirer des leçons de cette pandémie. Nous devrons penser à des changements que nous pouvons apporter dans notre vie de tous les jours et dans notre façon de faire des affaires. Nous ne pouvons pas simplement retourner à notre ancienne façon de faire les choses. In the days ahead, we will not just transition into recovery, we will transition into the new normal. We will all play a role in keeping the curve flat. Please continue to listen to advice from public health. By doing so, we can reduce the risk of a serious second wave of infections. I know we are all eager to start discussing what New Brunswick's recovery plan will look like. I look forward to providing you with more details about the plan in the coming days. I appreciate your continued cooperation and patience. Thank you. Merci.
Merci, Monsieur le Premier ministre et Dr. Russell. Thank you, Dr. Russell, Premier Higgs. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Premier Higgs, and it's regarding calls for improved ferry service to Campobello Island. Premier Higgs, I was speaking with the mayor of Campobello this morning and one of the members from the year-round ferry committee, and they're wondering, now that there has been a petition submitted to the legislature by MLA Kuhn, as well as written support from council for ferry service, why hasn't there been progress made to provide Canadian transportation solutions for Canadians forced to rely on a U.S. link, especially in a state of emergency where many islanders wish to avoid cross-border travel as much as possible?
I think we have certainly, dealt with this issue in relation to working with U.S. officials, ensuring that residents of Campbell Island could travel as they always have done for generations through the U.S. In order to get directly back into Canada and into New Brunswick. So that nothing has changed in that regard. So that is business as usual, and it's not necessary to stop or shop in Maine or in that sense. The other aspect of the ferry service is we're getting close now to the time of year, and we have asked to see if we can potentially move it forward. So I don't have a specific date or startup date at this point, but I would anticipate, if it's at all possible, it will be earlier than in previous years, just because it would be the right thing to do at this time and with the concerns that you've just outlined.
Thank you, Premier. Vicki, do you have a follow-up today?
I'm just wondering, in terms of potentially starting a year-round ferry, have you given thought to the idea of something with variable frequency where it wouldn't run as often in the winter and therefore would be more cost-effective?
I haven't seen any indirect information on what that might look like. There have been some general discussions, and with generally the outcome in each case that the usage would be so low that it really wouldn't make sense to provide the service. But I'm always willing to look at proposals that someone might put forward. But I think in every situation, you know, that I've seen thus far, it wouldn't be something that you would consider to run year-round. But if someone has an innovative idea in that regard and would like to discuss it further, I certainly would be prepared to do that.
Thank you, Premier. Thank you, Vicki. Elizabeth Fraser, CBC.
Hi there. My question is for the Premier, just about the pharmacy changes. What about those people who already pay the fee for refills? Will they be reimbursed since they really weren't drug shortages? Since there really weren't drug shortages, sorry.
So I do not see a reimbursement program coming forward. I think that the College of Pharmacists put together what they felt was a protection measure, and so I'm certainly, I recognize why they did it. I think what we've identified with the Department of Health and the Minister of Health, working with the college and with the local pharmacies, has been to determine that, you know, it doesn't apply to all drugs. So rather than have a sweeping model, we have one that will look at actual supply in detail. And I'm very confident that the local pharmacies will certainly, you know, ensure that they have an adequate supply. They can manage this. I think I need to reiterate that this wasn't a decision from the local pharmacy. This was a decision that they were kind of given as how they should operate. I feel very confident that the local pharmacies will ensure their customers, their community will be well supplied and only bring forward changes that they know are absolutely necessary.
Thank you, Premier. Ms. Fraser, do you have a follow-up today?
Yes. I have another question for the Premier. Will you be recommending that employees now working at home be given the choice of continuing to work at home?
Well, I think it depends on employer by employer. I would dare say there's going to be a lot of that comes out of this, and because I've heard countless stories of situations where they found it's quite, once you're set up and working online, it's been quite effective, and I think you're going to see more of it. I don't think that you could really put any company in a position where an employee just has the right to say, I'm not going to come to work, I'm going to work at home. I think that'd be difficult, but I would believe that you're going to see a whole lot of interest from companies of all sizes to provide and accommodate individuals that can easily do their work from home. And I think, you know, looking in government, much of it is to look as well as what can we do differently here? What can we do differently in terms of sometimes many of the I mean, I did not go to a federal conference that was being held in Ottawa back at the beginning of all this because of the concern of the outbreak. But the experience that I had that and in another occasion when I wasn't able to attend, it really went very well. I mean, the ability for me to be there and not be there at the same time was worked out very well. Having said that, I think it's important in some roles that you need to meet the people you're dealing with because there's a relationship built there that you can't necessarily, simulate online. But nevertheless, I think companies will look at this very seriously going forward.
Thank you.
Do you think companies
Thank you, Elizabeth.
working at home in the summertime, or?
What's that? They would be more inclined to work home in the summertime? Pardon me? What was the question?
Is there any kind of timeline? Like, do you think that people will be heading back into the office next month, in June?
Oh, as far as government you're talking about?
August?
And as far as government employees, yes, we're looking at a program there that would see people returning to work over the next several weeks, months. We're also looking at what we've learned here in government over the last 2 months, and how we do things differently. So there could be a combination there for sure. I would expect every company is doing the same thing. And the criteria of returning to work always must be that we can follow the rules and regulations as outlined by public health. We can find all kinds of innovative ways in government, in other businesses, throughout the province. But the public health rules have to be part of that solution until we find a vaccine.
Thank you. Silas Brown, Global TV.
Hi, Premier. Saskatchewan released a 5-point plan today of how it's planning on reopening the economy. I won't ask you about the specifics of that. Obviously, I know you're busy and likely not combing over another province's plan right when it comes out. But the date that they're giving to at least start initially opening things up is May 4th. Is that kind of the similar sort of timeline that you'd be looking at? Would be that kind of week right at the beginning of May there, or should we be expecting to see initial measures being lifted further into the month?
I guess at this stage, I'd indicate earlier in the week that I was meeting with the COVID Cabinet Committee and then with my own cabinet over these past few days, in which we have done that. And there's kind of two factors. One is in relation to allowing people to get back to their normal way of life in the new norm, the criteria being imposed, and then the phase of how businesses recover in the economy. So in looking at how we allow people to start up, that'll be rolling out for us in the coming days and outlining a series of kind of phases as well, that would go into the coming weeks and months. But my intention is, following the meetings, which were very successful, that we had with all of our team and public health included, obviously, is to roll something out in the coming days that would reflect our path forward.
Thank you, Premier. Silas, do you have a follow-up today?
I'm curious if this plan will include a back-to-work sort of plan for MLAs as well, for meetings of the legislature. I know that's something that some opposition members have been calling for. Green leader David Coons, in particular, figuring out how, even if you're doing it virtually or still being able to have a skeleton crew for QP, is that going to be part of this plan as well?
That's not part of my plan as such, or the plan we developed in isolation with the COVID Cabinet Committee and with my cabinet. But it is part of the request that we made collectively to LAC, the Legislative Assembly, to put together let's say a return to the legislature that would respect the public health rules. So I would say that as we roll out our plan for New Brunswick, we'll be outlining the health rules once again of what need to be part of the requirements, and that same requirements would go to the Legislative Assembly, and then we will get a program put together from them to us saying, here's how we think the legislature could restart. And yes, it could be a combination of the spacing and actually be in the ledge, or it could be a combination of a virtual legislative process. We've been innovative in a lot of ways, and probably it's time for the legislature to be a little innovative as well.
Thank you. Andrew Waugh, Telegraph Journal.
Hi. My question is to the Premier. Premier, we're hearing from business owners that some business owners that want to start the ramping back up process, that some of their employees are saying, hey, I'm not coming back because I'm getting more money via the CERB payments, so I'm just going to be off for the next 4 months. I wonder if you're hearing anything like that, and what advice you would have to small business owners who have complained to the federal government about this but aren't hearing anything back, nothing constructive anyway.
I am absolutely hearing lots about that, and it has been a major concern. A problem was created for many businesses by putting in a program that did not really, wasn't well understood, the repercussions, which is just what you outlined. So I think that the situation is here is the employer doesn't have an obligation to hold a position because someone chooses not to return back to work because they've got a federal program that helps them stay home. If the employer can provide and meet the safety standards that are outlined through public health, then that employee has an obligation to come back to work. If they choose not to, they can claim it on the basis of safety. WorkSafe will investigate and determine whether it's safe or not. The same logic applies as to with any safety standard implied in a workplace. But following all of that, the company will have fulfilled their obligation to that employee, and that employee could find in 4 months' time, when the federal money runs out, that they would wish they would have returned to work earlier.
Thank you, Premier. Mr. Waugh, do you have a follow-up today?
I do, again to the Premier. Given what you just said there, Premier, are you worried about what kind of impact this could have on restarting New Brunswick's economy? I mean, if there's a whole bunch of people out there that are being paid more than they normally under the stay home, this could present a fairly major problem.
It absolutely is presenting us with a major problem. So I want to appeal to individuals across the province that this is a short-term fix that the federal government put in place, and it was done for all the right reasons. The implications that followed, and then there was a top-up that was considered later, trying to get people to come back to work, as you know, and that was the essential workers clause and what that reimbursement might look like. So the point that we have here is that we have created ourselves a problem. We have temporary foreign workers that are destined to come into the province. We're saying we want to close our borders, and we have people at home that have chosen not to come back to work or not able. In case they're not able, that's fine. But in the case of choosing not to come back to work, that's a problem. And I would love to be in a position where our employees and our citizens would say, you know what, I can go back to work at this plant. I can work in this fish plant. I can work in this area. I can plant trees this summer. I can do a lot of things to help our New Brunswick economy and to help us continue to seal our borders. We need everyone's help, and to date, we've received it. I mean, we are where we are because we've had such great cooperation, both in the political foray through a whole nonpartisan approach, to the individuals taking it real seriously about paying attention to public health. We don't want to lose it now in the startup, and we need all hands on deck to start up. So if you're home and you're able to work, there are jobs coming, and we need your help.
Thank you, Mr. Waugh. Thank you, Premier. Matthew Guacomo, l'Acadie Nouvelle.
Ma question est pour le Premier ministre Higgs. Concernant l'annonce que vous venez de faire sur les médicaments, j'aimerais m'assurer de bien comprendre si le Collège des pharmaciens est d'accord avec cette directive-là, si c'était une décision conjointe du Collège des pharmaciens et du gouvernement, ou si c'est vraiment le gouvernement qui impose la fin des limites de 30 jours pour les médicaments au Collège des médecins.
The government is imposing this at this time because we think it's the right thing to do for the citizens in the province. We think that it's unfortunate that the pharmacists have got caught in the middle here because this was not a decision that was made by pharmacists or the pharmacy, local pharmacies. I believe, they've borne the brunt of it because they're customer facing and it's their customers that have seen, the results of people coming in that, are relying on keeping their expenses as low as possible to meet their month-by-month requirements. And so they're feeling it, but it wasn't their decision. So what we're doing is we're helping the local pharmacies, we're helping the local citizens, and we're trying to reduce the cost of living for them. And at the same time, protect the supply, which we know the College of Pharmacists was their intent. So we're trying to balance both here. We could spend the next couple months thinking about this, and then the situation may be over, or we could help people right now, right today. And so effective tomorrow, we're helping people. And we've chosen that path since the beginning of this pandemic, and that will continue to be our direction.
Merci. Monsieur Roy, comment as-tu un suivi cet après-midi?
Oui, cette fois-ci, c'est pour Dr. Russell. On a beaucoup parlé de la deuxième vague de COVID-19 qui pourrait venir à un moment donné. Pouvez-vous nous parler un peu plus de cette deuxième vague-là? Elle viendrait d'où? Elle pourrait avoir quel genre d'effet? Si les mesures restent en place, pourquoi il y aurait une deuxième vague? J'imagine que c'est ça ma question.
Alors, Mathieu, je crois qu'il y en aura la possibilité d'avoir plusieurs vagues. Alors, c'est ça le processus maintenant pour appliquer les mesures comme telles, puis les changer pour minimiser les restrictions un peu plus. C'est vraiment quelque chose qui va être décidé par le nombre de cas. et le sorte de transmission qu'on voit. Si c'est des transmissions de cas qui sont reliés au voyage, on espère de ne pas voir trop de ça parce qu'on espère que les gens ne voyagent pas maintenant parce que les frontières sont vraiment fermées, sauf que si vous voyagez parce que vous êtes un travailleur essentiel. Mais on a vu dans les derniers mois une couple de cas reliés qui n'étaient pas reliés du tout au voyage. Puis ça, c'est la transmission dans la communauté. Puis ça veut dire que si on verrait plus de ça, ça veut dire qu'il faudra qu'on remet en place les mesures qui sont ici maintenant. Alors, c'est ça, ça ne va pas être peut-être juste une vague. Ça peut être d'ici dans les 18 à 24 mois avant qu'il y aura un vaccin, ça serait plusieurs vagues. Alors, on n'aimerait pas voir des vagues comme ça, mais il faut être un peu, il faut réaliser, il faut être préparé pour des situations comme ça. Alors, c'est pour ça que les mesures qu'on veut mettre en place, on veut être vraiment sécuritaire dans la manière qu'on fait les décisions, puis avoir l'information, les dépistages, le nombre de gens qu'on peut faire tester. Il faut que ça soit en place avec le changement des mesures d'un bord à l'autre. Alors, encore, pour le succès, pour continuer, il faut qu'on a toute la coopération de tous les gens de Nouveau-Brunswick au niveau de laver les mains, ne pas toucher la face, porter des masques quand vous sortez, rester 2 mètres de loin de les gens, sortir seulement quand vous avez besoin, les choses comme ça, et aussi nettoyer souvent. Alors, ça va être le nouveau normal. Alors, pour le succès, pour les prochaines vagues, c'est vraiment pour éviter les prochaines vagues, si on peut. On ne sait pas vraiment si qu'on peut, mais c'est ça qu'on veut. Mais on est préparé sinon à appliquer les mesures qui sont en place maintenant.
Merci, M. Rocomont. Michel Corriveau, Radio-Canada.
Merci, Bruce. C'est une question pour le Premier ministre, M. Blaine Higgs. Alors, M. Higgs, je reviens sur la question du plan pour redémarrer l'économie. Comme vous le savez, il y a déjà des plans de ce type qui ont été présentés dans d'autres provinces et on s'attendait à avoir un plan aujourd'hui au Nouveau-Brunswick. Donc, quelles informations vous manquent en ce moment pour présenter le plan dès aujourd'hui?
So we've had our meetings with the COVID Cabinet Committee, with Cabinet, so we have a plan that is now being formatted. The intent is to make the presentation within the coming days. You know, I think what's important here is that it's not I recognize the timelines are important for people to understand where we're going. I think it's very clear that given the results we've had over the past week, that we have, you know, full agreement from public health and that we need to move forward, and with my colleagues. So this plan is coming forward. I'm going to just put it this way, that you will see it in the coming days, but I am saying within the very few days. We haven't just exactly nailed down all the specifics in relation to ensuring that it's comprehensive, people understand it, we're able to answer questions where they need be. I want to be able to put something together that gives more answers than questions, even though I know there will be lots as we bring this back. And it'll identify timelines of decision making, in addition to kind of initial startups. So it's on the cusp, coming very, very soon.
Merci. Monsieur Corriveau, as-tu suivi cet après-midi?
Oui, c'est toujours pour Monsieur le Premier ministre. J'aimerais savoir sur la question des médicaments sous ordonnance, la décision. Est-ce que c'est une décision du cabinet? Comment a été prise cette décision-là et comment vous allez vous assurer qu'elle soit suivie, qu'elle soit appliquée?
So yes, it was a cabinet decision. It was a full discussion with our team, our COVID cabinet team. There was certainly a general recognition of what we can do to ensure we can meet both objectives. One is to ensure we have adequate supply, and the other is to ensure that we are treating people with the lowest cost options possible. And so I'm pleased to say that we had unanimous support to make this happen. And you know, it's just part of moving New Brunswick forward together, and it's doing the right thing by the people that we work for, and that's all the citizens of this province.
Merci, Monsieur Corriveau. Adam Harris, Telegraph-Journal.
Thank you. A first question for Dr. Russell. Dr. Russell, the Prime Minister continues to say each day that the level of testing across the country must increase further beyond the current 20,000 tests done daily before the economy can open. Dr. Tam suggests the target should be 50 to 60,000 tests daily across the country. I just want to know what, if anything, that means for New Brunswick.
Well, when we were looking at our data so far and the types of parameters for being able to have confidence in the numbers in terms of the tests and the results, our goal is to maintain the same level of testing that we have right now at a minimum and then increase it from there. So, you know, that is the plan in terms of what we need for data to be I guess, for us to be confident in our data. So our numbers of testing are increasing. I think we tested over 400 people yesterday, maybe 460. And we do have a reduced number of symptoms, and we can keep reducing that number of symptoms, and we do have plans to do some testing of asymptomatic individuals and certainly targeting vulnerable populations. So our goal is to at least maintain what we have, if not increase. We obviously have the capacity to go up to 1,000 per day. And again, we do have to be cognizant of supplies and whatnot. So again, I work with individuals who talk about having a purpose. So we have to have a purpose behind what the testing and what the numbers are going to show us. So for being confident in the number of cases we have and who we're looking for those, where we're going to look for those and what that information is going to do to us, it's going to allow us to be confident in the information that we're using to base our decisions on around easing restrictions and limitations and public health measures and then re-implementing them.
Thank you, Doctor. Adam, do you have a follow-up today?
Yes, please. For Premier Higgs, Premier, you said yesterday that you're putting together a list of frontline workers in New Brunswick who could get a pay raise during the global pandemic. I just wanted to know, could you elaborate on what professions you're looking at, and do you have any update on those efforts?
So I don't have the list ready yet, but we're working in conjunction with the federal government, so it's in compliance with what they have put forward. So that's where it stands right now, and I mean there are several categories that would qualify to their 2,500 maximum limit, so 2,500 and under. You know, so there's a number. I mean, home care would come to mind, obviously, but that's I don't have the list to share at this stage, but we will have that in the coming days because we're working with the federal government to clarify exactly what they mean by their what they put forward. That's what we're having with problems in many areas is understanding, because when we get under the hood and look at the details and all these announcements, you know, it's one thing to get the announcement, and then it's very much another to get the details on what actually it means.
Thank you, Premier. Thank you, Mr. Harris. Laura Brown, CTV.
Hi, Premier or Dr. Russell. When do you foresee elective surgeries beginning again?
So two parts to that answer. One, at the national level, when we meet with our counterparts from the Special Advisory Committee, we are talking about the different types of risks in the different phases of lifting public health measures, and definitely that is part of that conversation. But then here in the province, we have a working group that is working on that right now to come up with a safe way to move forward with that at the moment.
Thank you, Doctor. Laura, do you have a follow-up?
Yeah, Premier, where does childcare, I know that you're going to release details in the next couple of days, but are you concerned about childcare centers reopening so that people can start to return to work? Like, where does childcare fall in the list, in the lineup?
It absolutely is a big factor in the lineup, because as we restart companies and people return to work, there has to be childcare spaces available. And all I can say right now about that is that we have reached out to many of the private operators, and we've had an overwhelming response of their interest to get back to work and to meet the requirements and fulfill what they obviously have part of their obligations of helping us to get New Brunswick back to the new normal.
Thank you, Premier. Barbara Simpson, Telegraph-Journal.
Hi there. This is a question for the Premier. Mr. Premier, as you know, the City of St. John has released its financial sustainability plan, and part of that plan calls for some immediate action from the provincial government. So my first question is, will the New Brunswick government act on the city's call for a tax levy on Greater St. John's residents?
So we have had a task force in place for some time now, looking at a greater sense of regional cooperation. I think I've said it more than once that I was one who lived outside the community and in Quispamsis and worked in the city my whole career, and I'm not unique. That certainly would be the majority of people living in the surrounding area of St. John. So I don't think there's any lack of obligation of the citizens outside to help the city get back on track, and certainly I would be one very supportive of doing that. What we had committed to on the taxation model was a comprehensive plan that would be rolled out in 2022. And we've been working with the city closely. There are a number of things that we've worked together on, and I went through their document they presented the other night. But I have seen, I knew where it was headed in many cases. What I see happening going forward here is kind of probably a proposal that we make as a government, and but it sees a tax reform. It sees other obligations that the city has to look at, because it's a joint effort to recovery. And I know it's heightened right now by the COVID crisis, because I had over 100 municipalities representatives on the phone here back on the line a week ago. Everyone is in a serious situation right now as we recover and get back to norm, because their community has been so shut down through this COVID virus. So any plan to get St. John righted, which I am committed to doing, is one that has to reflect the reality of the rest of our province in how we have municipal reform and a template that better reflects the realities of our communities in today's world.
Thank you, Premier. Ms. Simpson, do you have a follow-up today?
Yes. I guess just for clarity purposes, so then I guess are you suggesting, Mr. Premier, that the government isn't prepared to make any changes, whether it be a tax levy for Greater St. John residents or the return of the province's share of heavy industrial tax until the province completes its comprehensive tax review?
I'm saying that I think St. John could be a template as we roll out a tax model that could be very much used throughout the province. I'm saying that is certainly where I believe we need to be. So it's something that's reflective and works elsewhere. I'm saying that I've asked for a full evaluation of industrial taxes, so that I know that our companies are paying their fair share, and then what's that fair share for the municipality? Because I know that there were changes several years ago. Based on a market condition. So what does that look like now? I mean, given the current situation, I guess it's hard to say. I'm also saying it's going to be a combination of a kind of a number of factors that require both city initiatives and provincial initiatives and community support. What we have seen in the past, and I'll go back a few years, like here's 22 million, do what you will with it. That didn't solve the St. John problem. That didn't fix any long-term solution. I'm looking for a long-term solution for the city that I have worked in for over 30 years. I'm not looking for a short-term fix. And I'll work with my colleagues, as I said, both my cabinet and with my cabinet colleagues, and we'll figure it out, what makes sense. But it will be not just a, piece here, piece there. It'll be a comprehensive proposal that reflects what they've put forward and how the province can participate in a meaningful way. But at the end of the day, the problem will have a path forward that is sustainable.
Thank you, Premier. Thank you, Ms. Simpson. Colin McPhail, CBC.
Hi
Hi there. This is a question for the Premier. It's a follow-up to the pharmacy changes again. I'm curious, what do you think about whether the College of Pharmacists should have the power to initiate something that they benefit from directly?
Well, I'm not going to question the college as such in that regard because, they are there. I've never read the mandate of the college in terms of how they represent pharmacies. I know there's an association of pharmacies as well. I said earlier, I think that the local pharmacies got kind of caught in this situation, and we don't need to put them in the middle of this. If there is a legitimate drug supply concern, then it's something that needs to be laid out there. We can all look at the facts. I said this a few days ago and understand the reality of that, and that'll decide what's needed and what's not needed. But I've always been pretty interested in facts, and so I'm open to as the Minister of Health has stated, and as is what I stated today. We'll look at drugs that are in jeopardy of supply, and we'll ensure that is not going to be a problem. But the rest of them, let's get back to business as usual.
Thank you, Premier. Colin, do you have a follow-up today?
I do, thank you. Again, for the Premier, Prime Minister Justin Trudeau announced a $1.1 billion strategy for medical research to fight COVID-19. How do you see New Brunswick taking part in the various research projects underway?
Well, I would like to think that there'd be some strategy involved with that rollout. We will be questioning. I have calls I have calls this week. I'm meeting this afternoon with all my colleagues across the country, and then with the Prime Minister tomorrow. Last week we asked for something that was relatively simple, and we asked it as a collective body of premiers across the country. Could we get some insight and forward details of new announcements that were coming from Ottawa? Then we would be in a position to discuss, okay, what should this look like in relation to how it impacts New Brunswick, in my case, how it is best going to be utilized, in this case, for research. But today, and since that time, we haven't got any real follow-up for details other than what we see at the same time that you see it. So I'll have to understand the details behind this, and I'm sure we'll be developing those together. And then following that, we'll define what role that New Brunswick can hopefully play, because we'll want our people to be involved, for sure.
Thank you, Premier. Thank you, Mr. McPhail. Voilà la fin de notre mise à jour. Merci beaucoup.